Hello, everybody, and welcome this evening to this BTEC focused BTEC Health and Social Care Tech Award Component 3 revision live stream with Tutor to You. This evening, I am joined by my colleague Laura. Hi, Laura.
Hi, guys.
Hi. Thanks for joining us, everybody. So this evening, we are going to be looking specifically at the person-centered approach and a person's circumstances. And these are focused on questions 14 and 15 in the exam from what we can see from the sample assessment materials. Okay, so question 14 looks to be a multiple choice question that focuses on things that you need to take into account when you're looking at a person-centered approach. And that might be the importance of a person-centered approach for an individual or the benefits of a person-centered approach for healthcare services. And question 15 is one of those longer answer questions, which is a 6-mark question, and it's a discuss question. And that looks specifically at how a person's circumstances could affect their ability to follow recommendations for improving their health. Okay, so tonight's focus is those two questions, 14 and 15. And we're going to do lots of good revision, fun activities to get you thinking about those things. So we're going to have a look at our first slide. And let's have a little look. So that's the focus of today. And our first slide for this evening is we're going to start with a true or false question. So what we'd like to do is we're going to ask you a question and we'd like you to write in the chat whether you think this is true or false. So you can either give me a T, an F, or a smiley face emoji or a sad face emoji. So just to warm up then, true or false, a person-centered approach means putting the individual at the heart of healthcare planning so that all their needs can be met. Is that true or false? So just tap in the chat for us this evening so I can have a look. Oh, some people here straight off the back. We've got Lisa, Amelia, and Sanalin. I think you've joined us before, haven't you? And you're all saying true. Let's have a little wait, see if anybody else is going to join us. And the answer is true. Yes, absolutely. So we've got using a person-centered approach will help individuals feel involved in any decisions that are made, and this will give them confidence in the recommendations that are offered to them. Okay, so we know that it's really important to take this approach because people feel very valued and they feel at the center of their care. Okay, brilliant. Let's have a look at our next activity, and I'm going to hand over to Laura. Oh, you get a round of applause. Well done. Over to you, Laura.
Brilliant. So this one is called Give Me Two. So can you give me 2 ways a person-centered approach can improve an individual's emotional well-being? So can you give me 2 ways a person-centered approach can improve an individual's emotional well-being? What do we think, everyone?
And we've got 30 seconds on the timer for this one. So if you've just joined us, pop your answer in the chat. And the focus on this one is emotional well-being. Okay. Let's see what everybody thinks this evening. Okay, so 2 ways a person-centered approach can improve an individual's emotional well-being. Have we got anything, Laura, come through?
We have. Lisa Lee has said make them feel more relaxed because you're being kind. Amelia is saying make their needs feel valid by improving their confidence, reduce anxiety. And I think with this question, sometimes you've got to almost flip it on its head a little bit. Because sometimes the way that the questions are asked, it's not that easy to see what they're asking for. So sort of say, okay, so how does this affect emotional well-being? And think about what is emotional well-being? Well, it's how someone's going to feel. So how is it going to improve how they feel? And then think about those key terms that you know for emotional well-being. So like confidence, anxiety, self-esteem. We've got some more answers coming through now. So we've got Monica says it can make them feel valued and appreciated, thus improving their emotional well-being and even their social skills. We've got they're going to be focusing on the individual, so by meeting their needs they can feel at ease, so their emotional well-being will be good. That's a fantastic answer there.
Yeah,
Have we got any more?
Really.
Mine's just scrolled.
No, that's nice. I think we've got what I'm really liking is we've got some keywords that you're talking about there, Laura. So they've got confidence, reducing anxiety, valued, feeling appreciated, feeling at ease. Yeah, I really like that. Should we see what we've got for our answers? Let's have a little look.
Yeah, let's have a look. Brilliant. Yeah, so very much like you guys were all saying, increased confidence, and they feel happier.
Yeah, absolutely. And you might feel a bit more secure, mightn't you? You might feel more content if you feel confident that your healthcare professionals are putting you at the centre of their care. So just think about all that key terminology: confidence, happiness, reducing anxiety, security, contentment. They all relate to emotional well-being, don't they? Excellent. Okay, let's have a look. So let's have a look at our next one. Well done, everyone there. This one is a give me 4. Okay, so I'd like you to give me 4 examples of personal circumstances that professionals should take into account when providing person-centered care. So just remember that question 15, talks about what is it about the person's circumstances that will affect their ability to follow recommendations to improve their health. So what are those personal circumstances that they should be taken into account? Let's give you 30 seconds. What sorts of things does personal circumstances actually mean? That's what we want to get to the crux of today, don't we? See what we've got. And that word circumstances. Yeah, and that word circumstances is really important, isn't it? Because it comes up in question 15 and question 18. So we really need to know what that means. What does it mean? What have we got, Laura? Anything come up?
Yeah, Lisa's put 2 really good ones in my opinion. So she put if the person has a disability. So absolutely, if you've got disability, and also flipping that on its head, what is their ability? What can they do? If they have people to support them at home, which is a really good one. Then we've got religious beliefs, mental health issues, physical disabilities, financial barriers, if they've got money. Again, financial keeps coming up. And then thinking about barriers as well is what we've got from different people.
Excellent. Yes. So it's very much thinking about what is it about the person that should be considered, isn't it? And you can look at that from lots of different angles, which I think you guys actually have. Monica's come up with a really nice one here. She's talked about any disabilities they may have, but so that might be physical disability or ability as well. Mental illnesses such as dementia. I really like the fact that you've highlighted their age. So, Monica, that could be their life stage, what life stage they're in, how economically stable they are. So another nod there to financial situation and how they're able to get to places. That's a really good one, isn't it? Because if you're providing person-centered care, you want to know whether the person can actually get to the services that you're suggesting that they use. Should we have a look what we've got? Let's have a look on the screen. I think very similar to some of yours as well. We've got physical and emotional health, ability, living conditions, and the support they have. So Lisa's talked about that in terms of sources of support. That's really important. We're going to be looking at sources of support a little bit later on. So those informal and formal sources of support around a person that can really influence what sort of care somebody can have, doesn't it? If you've got lots of support at home, you're more likely to be able to be cared for at home. But if you live on your own, you might need to then have formal support coming into your home, for example. Okay, brilliant. So, yeah, excellent, guys. Okay, let's have a look at our next one. So, over to you, Laura, for this one.
Okay, so this one is categorized. So we're going to give you 60 seconds to separate the key phrases into 2 categories. Okay, so you've got 8 phrases or like bullet points. And we need to work out, are they under the importance of the person-centered approach for the individual that we're looking after? Or are they the benefits of a person-centered approach for the actual health and social care workers and the service? So see if you can work out which one they go into. So you might want to, if you've got a bit of paper, draw a little table if you want to, but you've got 60 seconds to have a go at this.
Brilliant. And you might want to write in the chat just the numbers. So you could write for individuals and then put the numbers, for services, then put the numbers. So what goes into which category? Look.
Loving the sound effect.
Yeah. Very dramatic.
I know. I feel like we're on a game show.
Yeah, Amelia said this one is tricky. So try and think about it from the perspective of why is it important for individuals versus why is it important for health and social care workers and services? Okay, brilliant. So Loves Anna's come in and had a go. Well done. Excellent. So let's have a look. So for individual, Loves Anna has said the importance of a person-centered approach for individuals is number 4, because they might feel happier and more positive about their health. It improves their independence. It saves money. Yeah, maybe for an individual, but I don't know whether that might be better for the other one. And number 7, it ensures their unique and personal needs are met. So I do quite like that. Amelia has also tried to answer that, and she has said for number 1, increases the support available to more vulnerable individuals, improves job satisfaction, not maybe necessarily for individuals. I think that's more for workers. Let's have a look at Lobsana. She's had a go at workers. So the benefits of a person-centered approach for health and social care workers is it improves job satisfaction. I think that sounds quite good to me. And number 8, I like, it reduces complaints, because that's very much about the service as well, isn't it? And let's have a little look at what Monica has said this evening. So the importance of a person-centered approach for individuals is 4, 5. You've said 6 and 7. I'm not sure it's necessarily number 6. I think that might be more for the services.
See, I think that
1, 2, 3.
I can see where they're coming from with this one.
Now, tell us, Laura.
Hear me out. I'm wondering if we're thinking of this from the terms of like barriers. So if you think about, if you are meeting with several people, for example, in one day, you've got less transport concerns to get you places, therefore money and things. And that's what I'm thinking. We could maybe be on the lines of, I can see their thinking behind it.
I like that school of thought. Absolutely. And obviously, if you're only seeing like one group of individuals rather than having to go and see loads of different services, it's definitely going to save your transport costs, isn't it? Yeah, brilliant. Shall we have a look then? Shall we see how we've categorized them? Let's have a little look. So yeah, what have we got there, Laura, then?
So we've put number 1 as importance for the individual. So increase the support available to more vulnerable individuals. We've got that it improves their independence. So number 5. Number 7 ensures their unique and personal needs are met. And number 4, they feel happier and more positive about their health and well-being. And then for the benefits to the workers and service, it improves job satisfaction. It saves time, it saves money, and it reduces complaints. And I've just seen Monica's put a message in. She meant saving money in the sense that they'll maybe pay less for transport or be offered treatments without having to pay for multiple ones. So yeah, that's a good way of thinking about it. The workers, I've just seen we've got a question there about how would the workers save money. It's not so much the workers individually, that's more the services in general.
Yeah, absolutely. And mainly because it's if you work together in a person-centered way and you work as a kind of a multidisciplinary team, it should be more efficient. So therefore it should save money. And I thought I might mention now, so the importance of a person-centered approach for individuals and the benefits for a person-centered approach for health and social care services and workers is very much those things are outlined in the specification, and that could very much be the focus of question 15. So knowing those different examples can really help you if you had some multiple choice options, for example. So really good one for you to revise this. Yeah, brilliant. Okay, so let's carry on then. So we've got a connection wall now. Okay, so we've got 12 key phrases that are going to come up on the board, and we want you to group them into 3 groups of 4. Okay, so we want 3 groups and they'll all have 4 things in them, and you have to find the connection. Now, I think this is a little bit tricky, so I might put it up on the screen, see if you can come up with a connection. But if not, I might tell you the connection and then you can tell me which ones they fit into. Okay. So when you're doing a person-centered approach, there's certain things you should consider. Okay. And on the board, these are all of the things that you probably should consider. But what groupings could we put them into? So I'll just give you a little minute to just look at them. And do you think there's some that lend themselves as being similar? Okay. Now, you don't have to write them all out in the chat. Just write A1 or B1 or B3 to link them together. There might be some that you think, oh, do you know what? They look like they're quite similar, and I'm going to put them together in a group. Just see if anybody wants to have a go. I'll just see if anything pops up. Otherwise, I'm going to give you a hint, I think. Might be a bit challenging.
And don't worry, guys, if you're struggling, because this is something that I would be sat there going, I have no clue.
Yeah, and sometimes you get these on TV shows, don't you? And I stare at them going, oh, I don't know what to think.
And then as soon as someone said it, you're like, oh, of course.
Yeah, it's really obvious, isn't it? It depends how much revision you've been doing. If you've been doing lots of revision on person-centered approach, you might kind of go, oh, these are connections. Okay, Amelia, well done, Amelia, for having a go. That's brilliant. So Amelia's talked about personal choices. So she's got B3 to give up smoking, C1 to lose weight, C2 to increase exercise, and C3 same-sex professional. You're sort of on the right track with personal choices. Okay, I'm actually going to say that there is a category which is wishes. Okay, but not all of the ones that you've suggested are necessarily in that collection. So one of the groups is called wishes, things that people kind of want to do or wish to do or kind of choose to do, like you've said. Yeah, that's good. We've got Sana B has gone for lose weight, increase exercise, and give up smoking. So they sound like they're quite well connected, don't they? Lose weight to increase exercise to give up smoking. They sound like sort of things that you might need to do. So I'm going to give you another hint that category is things that you need to do. But what else might be in that group? So if you've got to lose weight, to increase exercise, to give up smoking, what else might you need to do? And who else have we got here now?
So Monica said about lifestyle factors.
Oh, yeah, go on.
And then Lisa has said about is lose weight a need? Again,
yes,
we're putting sort of...
Yeah.
Go on, sorry.
Sorry, I was going to say Lisa is correct. Lose weight is definitely a need. Yeah, something that they might need to do.
Sanabi's saying D2, so vegetarian diet.
Okay, that feels like a choice, doesn't it? Or sort of a wish that somebody might have, or a preference, perhaps. Yeah. So
A2 is a need.
A2, lower brush pressure. Yes, excellent. Okay, so one of our categories, I'm going to tell you, our categories are needs, wishes, and circumstances. Okay, so the needs are to lower blood pressure, to give up smoking, to lose weight, and to increase exercise. Brilliant. So that's got us off the starting block. So now, yay, we've got a round of applause. So what are our wishes? What might be our wishes? So I think we can go to Amelia there. She's given us some good ones, hasn't she? So shall we reveal our wishes? We've got things that kind of people might prefer to do. So deciding on a certain type of treatment. So that's very much, people making a choice there. You might prefer or wish to have same-sex health professional, maybe because of cultural reasons. You might choose a particular healthcare provider. You might wish to have your operation carried out at a certain place, for example. And you might wish for a vegetarian diet because of dietary needs. And our last one then is the ones that are left. And these are circumstances that people might have. So you have to consider this in person-centered approach, don't you? You need to consider physical and emotional health. You need to consider whether people have got that formal or informal support in place. think about their ability, or do they have a disability, and their living conditions, okay, and maybe who they live or where they live. That's really important. So yeah, thinking about those needs, wishes, and circumstances when you're doing that person-centered approach to someone. So well done. Those last two were tricky, weren't they? Let's be honest.
Yeah, well done, everyone.
And what's Monica said? She said, is circumstances considered similar to life factors, such as environmental ones, for example, where someone lives, or if they have gyms or medical centres near them? Yes. So if you have a look, Monica, in the specification, it actually says what circumstances sort of means to this qualification. And it's lots of things that you're suggesting there. It's things like age, living conditions, physical and emotional health, the sources of support that people have, and whether people have an ability or not. It might be the location of where they live as well. So yeah, definitely. So when you have a case study in the exam, think about all of the things that are written in the case study, because all of those things will be useful about the person's circumstances. Okay, so brilliant. Yes, Sanabi's asking, is there a live on tonight? There's a 6:45 we're doing again as well tonight. So that's for the exam on the 10th as well. Yes, so Sanabi, we're going for it this evening. We're having lots of revision. Okay, Laura, over to you. Let's do the next one. So what have we got?
So we've got a bubble quiz. Okay, so we're going to show you a question. We're going to give you multiple answers, and you need to tell us which answers are correct. It might be 1, it might be 2, it might be 3, or it might be all 4 of them. So let's have a go at our first one. So which of these circumstances could stop an individual following a healthy diet? So it could be A, a stressful job, B, a well-paid job, C, shift work, and D, working long hours. So which is going to stop an individual following a healthy diet? So what do we reckon, guys? Pop your answers in the chat. A, B, C, or D. And it can be more than one. It might be none of them.
Yeah. So what do you think? Let's do quick typing. Well done, Amelia. Amelia's very quick on the messaging there, isn't she? So Amelia said A, C, and D. That's sounding quite sensible to me.
Oh, and Monica's saying D as well.
Yep, Sana B's agreeing, and Lee is agreeing. Shall we have a look? Let's see if you're correct.
Look.
Yeah, brilliant. So yeah, if you had a well-paid job wouldn't really stop you following a healthy diet. You've got loads of money. You can go and buy lots of lovely, nutritious food, can't you? But actually, the other things might make it difficult for you to be preparing healthy food or following a healthy diet. Well done. Let's have a look at the next one. We get a round of applause. Well done, all of you guys. So which of these circumstances could stop an individual from being more physically active? So if we got living alone, living in a flat, having asthma, working at a desk all day, what do you think? A, B, C, or D? 1 or 2 of them, or all of them? What do you think? If you're trying to be more physically active, trying to do more exercise, which of these could stop you? What do you reckon? We got anything, Laura, come through yet?
Not just yet. Oh, hang on. Unless these are Amelia's. Oh, these might be Amelia's new ones, actually, for this question. You've got A, B, C, and D. Monica's saying C, B, and D.
Yep. And
A, because they might not have someone to motivate them.
Well done, Sana B. That's a really good point. Yeah. Really good point.
I'm very lucky. I've got the dog. Otherwise, it wouldn't happen.
Yeah, I mean, yeah, your dog keeps you going out and exercising. That's what's good about dogs, isn't it? They make you go for walks. I think it might be all of them. I think maybe Sana B might be correct. And Amelia, what do you reckon? Should we have a look? Yeah, absolutely. Yeah. All of these could potentially stop you from being physically active because you might not necessarily have the support, you might not have a garden, you might not feel physically well enough, or you might be really busy at work. So absolutely, well done. So you're just getting used to that idea of circumstances. And usually, yes, a risk of robbery is leaving the house alone. So you might not want to go for a run at night because you might be feeling a bit worried about your safety. So yeah, absolutely. Let's have a look. Laura, yeah. one for you?
Yeah, so the next one, which of these circumstances could stop an individual reducing their alcohol intake? So we've got A, addiction, B, a recent bereavement, C, an active social life, and D, a supportive partner. So which of these could stop an individual reducing their alcohol intake?
Okay, nice. So we've got Amelia saying A and B, addiction and a recent bereavement. Monica's saying A, B, and C. An active social life. Yeah, I guess because if you are actively going out and you might be drinking alcohol when you're going out, that could actually be quite difficult to reduce it, couldn't it? If your social life is sort of made up of going to places where there is alcohol. And yeah, Sana B has added C now as well. So let's have a little look. What have we got? Yeah, excellent. You guys are on fire tonight. Some people are doing some good revision there. So yeah, so these
Yeah, because I
things very
think
much.
C is one of those ones where obviously you'll get a little case study when you get these questions. So you'll be able to find out a little bit more about them and it'll hint at things. So it might be that their active social life is that they go and play tennis twice a week. That's not potentially going to be a huge problem. But if it says that they go to the pub 3 times a week with their friends, you can see there's a potential there. And Monica's right, she's just put an active social life could imply that you feel more peer pressure to drink. Absolutely.
Yeah, brilliant. And just adding to what Laura said there, actually, yeah, so it's very much about interpreting the case study. Yeah, so reading it in the context of what's there and thinking, is that a positive thing or is that a negative? And then writing about that. Yeah, brilliant, really good. Okay, and let's have a look at our next one. I think this is our last bubble one. So which of these circumstances could prevent an individual reducing or stopping their substance misuse? So which might prevent you stopping your substance misuse, for example? So it could be a mental, unemployment, age, or supportive family. What do you think? So prevent an individual being able to stop it. So let's have a little look. What does everybody think?
I think this is a really difficult one.
It is a bit more tricky, isn't it? I guess if you think somebody might be using misusing prescription drugs, or they might be smoking cannabis, for example. So, and they want to stop. Which of these things might not help that? So Amelia has gone for unemployment. So if you're unemployed, you might be feeling a little bit depressed and sad, and you might not have anything to fill your time. So therefore, it can make it more difficult for you to stop your substance misuse. Maybe your age, so you might be quite young and not realize the long-term consequences, the physical impact of taking drugs that could be on your physical health. So that's really good. And supportive family, I think maybe a supportive family might help you stop. You would hope, wouldn't you? So should we have a look at our answers? I'm feeling like they might be B and C. Yeah, excellent. Well done, everybody. Really good. Okay. And Monica, she said, oh, yes, their age as well. Maybe because they're going back to feeling peer pressure. And that usually happens in the adolescent life stage. Well done, Monica. Yeah, fab.
Absolutely.
Okay,
yeah, brilliant.
We'll keep going this evening. Right, we've got a riddle now. So for you, we've got a question here. Captain Riddles is going to fly across. He's very loud, Captain Riddles. Sorry, I should have warned everybody about that. So he's going to fly across the sky and he's going to give 3 clues and you have to work out what the key term is. Okay, let's go. Let's see. So clue 1 is a fondness for something or someone. Okay. And clue 2 is picking what you like. So we've got a fondness for something or someone, picking what you like. And the last clue is a choice between 2 items. So what could the word be, do you think? Picking what you like, a choice between 2 items. What do you think that might be in the context of person-centered approach that we're looking at tonight? Anybody going to hazard a guess? So Lisa Lee said once. You're on the right track, Lisa. Yeah, so on the right track. It's not once, but you're on the right track. What might be another word for once or linked to that? Something that you really have to take into consideration when you're looking at person-centered approach. So we've got wants, we've got wishes. Yeah, on the right track. Another word for that. Anybody want to have a go? You always ask the service user about this. What are your something? It's quite tricky. Begins with P. So anybody want to have a go? Begins with P. The dog's having a go. Yeah, Lisa Lee, preferences. Well done. Yeah, preferences. Let's have a little look. Excellent. So we've got preferences, and he's going to punch the screen. There he is, preferences. Okay, over to you, Laura. What have we got?
Okay, so now, apologies about the dog, by the way. We've now got word smash. So we're going to combine the clue with the question to create an answer that smashes both together. So here we've got a little image of a person. And what does it mean to place something in the middle as a focal point? So what word could we put together, or words could we slot together that this might stand for?
Okay,
Any
so the picture
ideas?
is something. The picture, what is the picture of? And then what does it mean when you place something in the middle as a focal point? It's very much what we've been talking about this evening. Anybody want to have a go? Let's see. What's happened to, who's really quick at typing? Amelia, you were really quick at typing.
I know everyone's very quiet.
Any thoughts? Any thoughts, Amelia? What do you think? Or Monica? Okay, Lisa said body centre. Okay.
You're on the right lines.
So, yeah, you're sort of on the right lines. Body's not quite right. Yeah, Amelia, thank you. Person-centered. Yeah, so the person on the left.
I was an Amelia.
Put it in the middle, person-centered. Brilliant. That's what we focus on tonight. And then I think we've got one more before we have a little break, and we'll be back at 6:45. So on the left, we have a picture here of something. What are all those people potentially maybe doing? And then on the right, we've got to gain pleasure or contentment from something. So what does it mean to gain pleasure or contentment for something? Okay, and something on the left. So I want you to think about, Lisa said workers' happiness. Yeah, kind of. So person-centered approach, it is really benefits, we know, the workers and the services, don't we? And they might get something from that. There might be an increase to something for them. Anybody want to have a go? Who did really well before? Amelia, any ideas? So
think of a different
Lisa,
word for happiness.
Yeah.
Might help you.
Have a little think. Anybody's going to have a go. Sometimes we have a little delay between people typing and it coming up. So I don't want to jump in with the answer just yet. Or everybody might be ready for a quick drink before they join us at 6:45. What do we think? Shall we reveal it? Let's have a look. So job satisfaction. Yeah, so on the left, we've got people, job satisfaction. So if you're working in health and social care and you're doing person-centered approach, you should have greater job satisfaction. Okay, brilliant. So I think that was our last one. So we are coming back at 6:45 this evening. We're going to be looking at questions 16A and 16B then. We're going to be looking at recommendations and actions aimed at supporting health and well-being. And we're going to be looking at support available from following recommendations. So go and get a quick drink and a snack, and we'll see you back in 10 minutes. Okay, thanks everyone, and excellent work. So we'll be back in a minute, 16A and 16B. Thank you.
Bye,
guys. To rejoin.